Alrighty, well, my name is Chase, and I'll be talking about hardware disease of cattle today. So, hardware disease, and what is it? Hardware disease happens when a piece of metal, such as a nail or a wire, pierces through the wall of the reticulum and travels towards the heart. Sometimes the metal may even penetrate the heart sac or diaphragm. Just a brief touch on the cow's stomach anatomy. Cows have a four-chambered stomach. The four chambers are the rumen, the reticulum, the omasum, and the abomasum, each chamber having a very important part in the cow's digestion. So the origin of hardware disease, it affects the reticulum specifically, which is the chamber of the stomach that catches heavy items that the cow may ingest. When metal is swallowed by the cow, it gets caught in the reticulum and can pierce through the wall of the stomach. And once through the wall, the metal can travel forward toward the heart, causing infection. Some signs and symptoms to kind of look out for. Some symptoms of hardware disease is going to be depression, inappetence, some reluctance to move, or even the cow may grunt when forced to move, and can sometimes show pain when trying to defecate. If perforation has occurred, we may also notice some fluid buildup within the brisket, meaning so the forward part of their chest could be swollen with fluid. The cow could even seem bloated, but this sometimes may fluctuate, so it's really hard to tell. Or the cow may stand with an arched back, which the cow on the left is standing with that arched back, and you'll see the cow on the right has that fluid buildup within the brisket. So diagnosis of hardware disease can be difficult since a lot of the signs and symptoms resemble that of other GI issues that cows can get, such as bloat versus other things like that. But according to the Merck Veterinary Manual, sometimes applying pressure to the cow's backbone above the withers can indicate hardware disease since it causes the cow's thoracic cavity to expand, which is painful to the cow if they're having a perforation, meaning the metal has pierced through the wall of the stomach. That can hurt. So if the cow does audibly grunt, this means that pain can be traced to the the pain can be traced to the front of the cow. And all these signs can indicate that the cow may have hardware disease. There is no definitive way to see if the cow actually does have hardware disease without being slaughtered or and examined. So a definitive diagnosis of hardware disease would be if after the cow is slaughtered, the heart and reticulum can be examined for either a piece of metal. If there's no metal, that either it's been digested by the body or otherwise. There may even be an abscess located in between the diaphragm and the reticulum, or it might even be adhered to the diaphragm. And this could be indicative of hardware disease. So unfortunately for treatment, if the cow doesn't have much value to the person who has it, slaughter may be recommended for that cow. And that way you can also examine and see if that may be what the cause was. Otherwise, if the cow is being used for breeding or is a dairy cow, some treatment may include putting the cow's forelimbs, meaning the cow is standing on a slope about 6 to 8 inches tall. This can actually stop the forward movement of the metal. However, this does take a long time. It can take anywhere between 10 and 20 days. And typically the cow is given antibiotics to prevent any further infection. And the cow does have to be at a constant slope for that 10 to 20 days, so it is not able to move around much. Otherwise, if the cow is of high value to the owner, a rumenotomy, meaning there's essentially a surgical incision made along the last rib and a hand is extended behind the ribs to palpate for either adhesions along the diaphragm or even feel for that foreign material. And then once that is located, then the object is manually removed from the reticulum and then the cow is sutured up, which would be a very costly procedure for a cow. Typically, prognosis for a cow with hardware disease depends on how long the foreign object has been present or even how far along infection may be if it has already set in. Generally speaking, about 60 to 75% of affected animals can be treated if caught early and treated early. A good preventative measures for hardware disease, they are able to place a magnet within the cow's reticulum using a balling gun, which is also the same tool used to medicate cattle as well. This will hopefully catch any metal that the cow ingests throughout its life and prevents it from puncturing the wall of the cow's stomach. So this is something that is placed within the cow and it lasts the cow through its entire life. And here's my references. Thank you so much.